Welcome. I'm Dr. Angela Yeagley of Sage Integrative Medicine Clinic, here with my great friend and colleague, Dr. Anastasia Jones, who's recently joined the Sage team.
Hey there.
Today, we are super excited to announce the first show of what will be a weekly series on health tips and solutions on optimizing health and wellness. The first topic today is going to be on ozone therapy, which I love. And we're going to explore the top 5 uses of medical ozone on reducing pain and stimulating regeneration in your body.
I think that's a great topic. Pain is something that everybody can relate to. At least I would say most people over 30 or 35 have been affected by pain in some way, whether it's a sports injury or some kind of a chronic recurrent injury or arthritis. If it's anything that's keeping people from doing the things they love, this is a really good topic as well.
Right. Agreed. And, what's really amazing about ozone is that when we get it into the body and into the joints, the way that it works is that it actually has a pain relieving effect while working on regenerating your cells. So, for instance, actually can regenerate cartilage in the joint space, as well as increase antioxidant activity in your body and within that joint, which speeds healing. So it's pretty incredible.
That's really amazing, actually, because it seems like so many things that people do for pain management, actually just numbs the pain, but the damage continues to happen.
Right.
So it's not actually helping the body to heal itself or repair the way it sounds like ozone does.
Right, exactly. Yeah, and that's why it's listed in one of the regenerative therapy or regenerative medicine, why it's in that class, even though you definitely can use it for pain. So launching into number one use for ozone is for knee pain. I would say this is probably one of my favorite joints to actually treat because it is such a good responder to healing. So the healing of injury as well as the reduction of pain long term.
And that's actually something that I can totally attest to. So ozone was fairly new to me, and I'd heard great things about it and seen other people have really good results with it. So I had a knee injury last fall, and it just wasn't getting better. It wasn't like this major blowout, but it just hurt all the time. And anytime I tried to do anything, and I was kind of worried that I was going to be, oh no, I'm one of those people that's going to have like chronic knee issues. One more thing, I'm getting old, yada, yada. And so I finally came in and I got an ozone treatment. And I would say within 48 hours, because I tried everything else already.
Yeah.
Right. And it helped a lot, but I was still just at this point where it just wasn't getting completely better. Within 48 hours, it was pretty good. And I tested it out on a run a couple days later. It was good. And it stayed great for like 6 months. And then I had another little tweak, came in and got a second treatment, and it's been good ever since. So I'm totally convinced and sold on it.
Yeah, it's incredible. I had that same experience, actually, different circumstances, ski injury, and within 2 treatments, it was completely resolved after having pain for months. And this is what I see in people, whether it's an acute injury or chronic arthritis or chronic long-term multiple injuries on the knee. We can get a shift into a place with most people. I mean, of course, nothing is going to work for everyone, unfortunately, but with most people, we can actually get instant, once someone has the treatment, instant reduction in pain, as well as stimulating the regeneration process, which actually continues for months after you have the injection.
So I know that, for example, with like the knee pain, a lot of times it's just a really localized injection right into that joint. What if somebody's got pain throughout their whole body, like both knees, a shoulder, like that would be a lot of injections.
Right.
Is there another way?
Not many people want that.
No.
Right.
Is there, so if somebody's dealing with like multiple areas, multiple joints that are inflamed, that are painful or damaged. Is there a way to address that that's more?
Absolutely, yes. So we can actually do ozone systemically and it will go to all of the joints and start working on healing all of the joints. So this is typically our approach, right? So because, as Dr. Anastasia said, we really don't want to be, most people are not excited about having every single joint in their body injected. So what we do is we'll do several treatments of systemic ozone. And really, I mean, with that, we can see incredible reduction in pain. And then, there are situations where maybe one particular joint is having a harder time, and we will work on that one joint. And actually, I have a great example of a woman who came in with chronic degenerative arthritis. So just, bad arthritis in every single joint, from her neck to her back, her knees, her shoulders, her wrists, her feet, so that's really, terrible. She was in a lot of pain and a lot of heavy duty pain medication. And so within one treatment, she noticed a difference. And we went on anyone who has that severe of pain, you're looking at multiple treatments. But by treatment 3, we were down quite a bit in pain. And by treatment 5, she was already working with her pain doctor to reduce her pain medications by half.
That's really great, because there's so many people on really heavy duty pain meds that may or may not even be really working anymore, but it's also compromising their quality of life. And so I've had so many people say like they don't feel like themselves anymore, or people talk about their loved ones are like, they're just not the same on pain meds. And ozone does not affect people's function, their cognitive ability, their ability to do things.
Yeah,
the way
no side effects like that. Yeah. And in fact, this is another topic, but ozone can actually improve cognitive function or functioning of the brain and thinking and focus. So you get other benefits beyond your joints, which is pretty cool.
Yeah, we can talk about that.
That'll be another show. Okay. But the next area that people struggle with quite a bit is back pain. And there's another technique for this as well. But we get into working on the muscles around the spine through a therapy called trigger point, and can also get directly into the back or the area around the back with ozone. And we have the same types of effects.
I've been doing trigger point on my patients for years, and I just recently added ozone into it, and it is like just taken it once again to like a whole different level, like a therapy that was already really, really good and effective. Absolutely. It's just to see that just improve the outcomes just from such a simple addition. That's really cool.
That's a really good point. I mean, it really does move it up to another level. Yeah, another level of healing. So another area that, so for number 4 on our list of 5, I've used it quite a bit also for fibromyalgia. And this is a tricky one.
Yeah, it is. It's a really, really challenging, challenging sort of syndrome to work with people, because there's so many different causes and it manifests in so many different ways. And then people get a diagnosis of it, and some people are like, great, at least I have a diagnosis, but other people just feel really hopeless because they think there's not a lot that can be done for it. Right.
And, as you mentioned, there are many factors that go into fibromyalgia, and all of them need to be addressed in like nutrition and inflammation. But, with doing all of these therapies, again, it's almost like a leveling up again. When we add the ozone, all of those processes seem to work so much better. And we get systemic or full body healing, which is pretty incredible to watch. And lastly, our last area of pain that I just want to touch on, and again, this could be a big subject, is actually helping with nerve pain, which can be quite devastating as well.
Oh, yeah, it's definitely debilitating for a lot of people.
Right. And a lot of people experience that maybe after a shingles outbreak or, having MS or multiple sclerosis, or having some type of herpes outbreak can leave lasting nerve pain.
What about diabetic neuropathy?
Absolutely.
That's one that
that we see more commonly
as well. Yeah.
Right. Yes, again, because of the regeneration aspects and the antioxidant aspects, we can get a shift there. And it happens typically pretty quickly. Is
there, so it sounds like a really great option for most people, a lot of people. Is there anyone who wouldn't be a good candidate for ozone?
Yes. Unfortunately, not very many people can't do ozone, which is great. But we do have to do some screening before we can do the therapy. So the things that we look for are G6PD. I know that sounds like a strange condition, but it's actually extremely rare, but it's just something we have to screen for through a simple blood test. Then we have to look for elevated iron. If that's there, that also can be treated and people can still receive therapy. And then low platelets.
And is that because it's a blood thinner? So ozone can thin blood a little bit, which is typically a good thing for most people.
Yes,
right?
yes. Okay. But just for a very rare few that, So we check, we do a little bit of blood. Usually all of those are covered by insurance, which is great.
Yeah.
So,
and we're typically going to do like a basic blood panel on people anyway when they're new patients. So it's not really anything extra out of the norm.
Right. Yeah. Exactly. Yeah. Okay. So
it sounds like incredible medicine. Like, I mean, I know it is, but I think probably to other people watching this, just to know that there is like another option for pain reduction or resolution instead of just like popping a pill that might kind of help them get through the day is really exciting.
Yeah, it's extremely exciting. And of course, we love talking about it. We love educating people on ozone and we'd love to have a conversation with you. We offer free 15-minute consults for people that love to come in and just have a conversation if ozone therapy is right for you.
You can get on the schedule. Best thing to do is go to sagemedclinic.com. You'll be able to check out some of the specials we're offering, some ozone packages.
Right.
And also get our information to call and schedule a consult.
Right. Absolutely. Well, thank you so much for joining us, and we look forward to seeing you next week.
We'll see you soon. Thanks.